Glaucoma is a big part of my practice, and it's oftentimes a very confusing disease to have. In fact, a very scary disease to have. Glaucoma is a disease in which the optic nerve within your eye begins to degenerate. Originally thought to be solely due to pressure within the eye, but we're finding that some folks really don't have high pressures yet do have glaucoma damage. So we're beginning to think that there's a lot more to glaucoma than just pressure. We know that glaucoma is a condition which can cause blindness, and in fact is the leading cause of blindness for patients over the age of 60 in this country. But it's also a very, very treatable condition. The scariest thing about glaucoma, and the most frustrating thing about glaucoma, is that you as a patient, you really don't know that you have it. You don't see the effects. You don't feel the effects. But understand that through the testing and the devices that we have here in the office, we are able to detect early glaucoma, and we are able to detect whether or not that glaucoma is progressing. When we talk about pressure and lowering pressure, the whole design is to get the fluids out of the eye. And for the fluids to get out of the eye, they have to pass through what is called the trabecular meshwork and go off into circulation. So medications were designed to open the trabecular meshwork and allow the fluids to come out. Controlling the pressure is done in several different ways. Medication has always been the cornerstone for treatment to glaucoma, and those medications are in drop form. The side effect of glaucoma drops, even the simple ones, can cause redness. Some of the more complex ones can actually cause systemic problems. So we try to minimize the types of medicines that we use with the eye. So when you think about avoiding side effects, that's when the laser procedures really become a tremendous option in managing your glaucoma condition. Selective laser trabeculoplasty physically goes in there with laser energy and disrupts the pigment within the trabecular meshwork and allows the fluids to get out more effectively. We find that it's been very effective for a large percentage of folks. And if you think about it, it has a 24-hour effect in your eyes. If you put a drop in, you have a large effect, and then that effect of that drop begins to diminish over time. But the SLT stays viable throughout the day. So it's really gaining momentum in being the first line to glaucoma management. In my practice, I find when you have mild to moderate conditions, mild to moderate glaucoma, that SLT is certainly a very viable option, and I recommend it to many patients. We're finding that with the medications for glaucoma, insurance companies may cover it, they may not. You may have a high deductible, you may have a high copayment, and many people can't afford these things. They do get expensive. SLT lasers is a procedure that is covered under your insurance policies. The payment of the medications would also include whether or not you've met your copayments or your deductibles for that year. Same holds true with the SLT laser. It does come under your insurance policies, and therefore copayment and deductibles may come into effect.